Good evening, everyone, and welcome back. I'm Daniela Murgia from Vets for Ukraine 2022. Before starting, I'd like to congratulate with Kalush Orchestra for winning the European Song Contest. This is an example, as Rob was saying, of where we could what we could achieve if we join our forces. Today is a special day. This is a special live because exactly 2 months ago, 15 specialists decided to join together in what is Vets for Ukraine 2022. One of these specialists was one of the 15 original specialists was Professor Dick White, who very promptly replied to my appeal to create this, all this. And Vets for Ukraine 2022 is honored to have him tonight for this talk on the canine larynx, because Professor Dick White recognized for his important role in the soft tissue surgery in the world, and is an example of innate leadership. Exactly now in these times where the leadership has, like we hear everywhere talking about leadership and what we should do to become good leaders. Well, Professor Dick White is a leader in our profession, in our specialty. I remember now about 4 years ago, I joined the Equa Referrals, and I remember it has been always my dream to join to work in this referral hospital that Professor Dick White founded at the beginning of the 2000s. So it's characterized by 3 important words: excellence, trust, and care. So we will ask Professor Dick White what these words meant to him, but I just remember how important it was to me to join this team of international specialists and amazing people. I won't be the one presenting or talking more about Professor Dick White, because I would like to give the opportunity to other people that have had the honor to work with him and to meet him to present him. So it is at this stage where I would ask Paolo to let enter in our live other colleagues. Yes, I think it's time to let our guests in. Paolo? Hello, Vicky. We have Vicky Lipscomb from the Royal Veterinary College. Hi, Vicky. Welcome back. How are you?
I'm very well, thank you. Nice to see you. Very excited about this evening.
So, Vicky, you have had the honor to work with Professor Dick White from the very beginning. Yeah, do you want to tell your story?
Yes. So, hi, Dick. I wanted to share that I first met Dick in 1995 as final year veterinary student at Cambridge, and mostly up until that point in my career, I really thought that I might be an equine vet, potentially equine surgery, but definitely equine. And the first rotation of my final year was soft tissue surgery in the small animal hospital with Dick. And that was one of the factors that changed my outlook completely. I absolutely loved the rotation. And I signed up at that point to spend my elective weeks over the summer with Dick, just scrubbing into more surgeries and watching him work. And I also realized you need a winch to about 10 people to get a horse onto a table, and there were things you can do in small animals that you just can't do in horses who are 800 kilos. But my eyes were opened to all of those cases that I saw, and I haven't looked back since. I have since that point pursued soft tissue surgery as a career, and I still love it every single day. The variety and the work is something that I love to do. So thank you very much for introducing me down that path, and for everything you've done for the profession ever since.
Thank you, Vicky. This is very interesting because I haven't said that the very first time I heard of Professor Dick White was when I was a young resident in Munich. And I remember that my supervisor, Professor Matis, asked him to join the vet school, also to the clinic, the hospital, because we had a dog with shunt. And Professor Matt is an orthopod, so and Professor DY came for the day, and he did operate the shunt, and then he left. So which was really the very first time when I heard his name, and then since then, obviously, he's a legend. So, Paolo, have we got someone else that wants to talk about or introduce Professor Dick White? Let's see. Davina, your microphone is off. You are mute.
You caught me out there. I was quietly sort of reminiscing, really. Hi, Dick. Long time no see. So I'm one up on Vicky, actually. I just worked out that I've known Dick for just over 2/3 of my life, which I'm not sure if that's a good thing or quite worrying. I met him 35 years ago. Much like Vicky, also on my starting the final year rotation. And I also did my elective in surgery over the summer, working with him and John Holton, and never really looked back. I did dally with mixed practice, but for 2 years, and that was enough, really. Cesareans in the middle of a field in the pouring rain. Actually, this is really not the way to go. Actually, one of the things everybody talks about Dick and the sort of legacy of all the surgery, but what not everybody knows is that he's also done a lot of work rescuing moon bears from the bile farms, and worked on developing a practical solution to reversing the cholecystostomy fistulae that these poor animals had done on them, and then you have to reverse it in order to allow those animals to be rehabilitated and rescued. And he did the first surgeries and presumably has taught people how to do it going forward. And that was an amazing, innovative use of his incredible skills. So yeah, I'm looking forward to this evening.
Amazing. I didn't know this story about the moon bears, because there is a colleague, Claudia Hartley, that is still doing her journeys to China and other countries in Asia to do surgery on the cataract of these bears. Yes, it's a really great job. Thank you, Davina. So I don't know if everyone knows, Davina has been a past president of the ECVS, the European College of Veterinary Surgeons. And to honor Professor Dick White, we have invited the current president of the ECVS, Dr. Tim Greet.
Hello.
Hello, Tim. Welcome.
Yeah, it might seem a little strange that an equine surgeon is introducing a lecture on canine laryngeal hemiplegia, but just to explain a little that, I'm the current president of the European College of Veterinary Surgeons, of which Dick White and Davina are also are diplomates. But the most important thing is that in 1992, the ECVS was the first European college to be established. And I was amongst the group of surgeons who passed the first examination in 1993. The founders of that college were Professor Jörg Auer of the University of Zurich and a Dr. Dick White, then working at Cambridge University. They shared a vision that a specialist college would provide the opportunity of creating training programs and a certifying examination that ultimately would promote a better quality of surgery within Europe, to create a group of specialist surgeons. They were both diplomates of the American College of Veterinary Surgeons and had seen how the ACVS had driven up surgical standards in the United States and wanted to achieve a similar effect in Europe. 30 years later, the ECVS has almost 1,000 diplomates based in over 30 countries around the world. which is an extraordinary success story. However, this is not only Dick's only claim to fame, because having graduated from the RVC in 1976, he was appointed a clinical oncologist at Cambridge University Vet School, and he worked there for over 20 years, including a period of time at the University of Tennessee. And in 2003, he took a risk to set up a small animal referral hospital in what you might think was a rather unlikely situation at 6 Mile Bottom between Newmarket and Cambridge in East Anglia. Almost 20 years later, this has flourished and currently employs over 30 veterinary specialists in different disciplines. Dick has an extensive CEV, has published over 100 scientific papers, and is a recognized specialist by the Royal College of Veterinary Surgeons, the European Board of Veterinary Specialization, the American Board of Veterinary Specialties, and he lectures, as we all know, regularly at international meetings. The catastrophe that we all see that has befallen Ukraine has triggered a massive outpouring of sympathy from around the world. There's been a huge response from many countries trying to provide support to a nation fighting very bravely for its independent existence. The Vets for Ukraine 2022 initiative is one of a number of veterinary activities, raising funds, providing webinars given by veterinary specialists. And tonight, Dick is going to talk on laryngeal hemiplegia in the dog. As an equine surgeon, I've spent quite a large part of my career dealing with laryngeal hemiplegia in the horse, which is a common and important disease, frequently disabling athletic endeavor. It still represents a significant surgical challenge, which has occupied the time and attention of many surgeons, but has also fostered a collaboration around the equine world. And it's something which I think we're beginning to get to deal with in a much more effective way. So to finish, I'd just like to thank you, Dick, for your contribution to developing surgical specialization within Europe. It's been a huge achievement in setting up the ECVS, and I'm sure that everyone listening to this will thoroughly enjoy the webinar you are going to give in support of a truly worthwhile cause. So thank you very much, Dick, and very nice to see you, my friends from ECVS and elsewhere. Thank you.
In the meantime, shall we introduce Professor Dick White?
Hello.
Hello, Professor.
So let me begin by thanking everyone who said such nice things about me. There was a point I have to admit during those introductory tributes where I began to wonder who the hell the speaker was tonight. It certainly wasn't going to. So thank you all for the kind words. And let me begin by saying it's a great honor to be able to contribute for Vets for Ukraine and to pay tribute to Daniela and Paolo, who've done so much to get things moving along. So, Daniela, are we going to start now, or are we waiting for...
So we have a message from Kate Forster. So can you read it?
Yes, she remembers coming into work in pink dressing gown in the middle of the night to operate. And pink has always been my favorite color, as we can see from the color scheme tonight. I did a surgery last week and got into my pink scrubs that I've had for many years. And unfortunately, they don't really fit. I may have to get a new set if I ever operate again.
Now I have a story. When originally we were allowed to choose our own color of the scrub, the theater scrub, and I was clearly told by the dispensary people that I was not allowed to pick up the pink because pink was your color. So it's still not possible to pick up the pink. Anyway.
There we go. Daniela, back to you.
So thank you very much. Absolutely It's an awesome presentation with a 3D function. So again, click just on the link, justgiving.com/vets for Ukraine. And so you can see the link here. And in the meantime, we have another guest who is Tatiana Kramova. I hope I have pronounced the surname correctly. And
almost.
Hi, Tatiana. Tatiana is one of she's a vet. She's an Ukrainian vet, and actually, I don't want to say too much. I would like to ask Tatiana to introduce herself and to tell us her story, if this is okay, Tatiana.
Yeah. Good evening to everybody, and thank you, Daniela, for having me here, and thank you, Professor White, for your interesting lecture. It's an honor for me to finally meet you online. I still remember your marvelous lecture at NVC in Moscow in 2015. One of the lectures was actually about laryngeal paralysis, and I still have it. So.
Good.
Yeah, it's a pleasure for me to meet you. So a few words about me. I used to be a soft tissue surgeon and surgical oncologist in Ukraine. So kind of specialist, but not a diplomate of any colleges. But I used to work as a referral surgeon. But on the 24th of February, my life changed completely. And I'm from Kiev, and my city got bombed, and there were missile strikes on it. So I spent 5 days of such a life, and then I've decided to leave my country with my family because it was too dangerous for me to stay. So me, my old mom, and my dachshund, we left Ukraine on the 2nd of March. We crossed the border of Romania. And now for almost 3 months, I'm staying here in Bucharest. My friend Vitalaro Bogdan Alexandru from Bucharest, he has invited me to live in his house. And I spent there for more than a month. And now he rented me an apartment where I'm currently staying. And by the end of this month, or maybe at the beginning of June, I hope to relocate to the United Kingdom. We already have visas by Homes for Ukraine program. I just have to collect all the papers for my dog. It's really hard to import a dog to the United Kingdom. So I really hope to meet all of you in person.
Thank you, Tatiana. You're very welcome. And
yeah, I've heard about alternative route of doing residency, and I know there were some Russian veterinarians who did it, like Ekaterina Kuznetsova, who did an alternative residency in dermatology. Well, unfortunately, having the war in my country makes things a bit difficult. So I hope to do residency in surgery being in the United Kingdom, but the main problem for the moment is that our Ukrainian veterinary degrees are not recognized by RCVS. So I will work as a veterinary care assistant, back to basics, let's say, and I have to sit and pass, hopefully, the RCVS tutor membership exam, and then I can hopefully proceed first to the rotation internship and then to the residency in surgery.
Good. Well, if you need any tuition that you think a very old professor can give you to help you get through the RCVS exams, as a previous RCVS examiner, I'll be very happy to help you when you come to the UK.
Thank you.
And I think I speak for everybody here tonight. We'll all be delighted to help you.
absolutely.
Yeah.
Everybody's nodding. Yeah, we look forward to meeting you.
Thank you.
Absolutely, yes. And again, it's a question open to everyone. So with there is this word that right now is trendy, is like leadership, being a leader. What do you think are now the requirements nowadays to be a good leader in our profession? It's like a 7 million
7 million question with a grenade with a pin taken out of it. I think really the most important quality for somebody who wants to lead is you have to have a vision. You have to know where you're going, and then try and take people with you. And I think in far too many situations in our profession, we see lack of vision, lack of we're here, we really want to be here, and this is the route to get it. People who try and work out strategies for clinics without knowing where that strategy is going to take them, as you can probably tell, really irritate me. Leaders need to have a vision. I think that's the most important thing that I can probably distill from my experience. Have a vision and try and take people with you.
Any other comment from Vicky or Davina? Or?
Yes, I guess, well, there's really only two things you need to do when you get to that level of leadership or management. And one is to have a vision, and the other is to communicate it well. And so I guess the thing that I add to that is I try and have a happy team, because basically everything else will fall into place. If people are happy, they'll work well, they'll do all the things they need to do. Not always easy in our profession with all the challenges that we come across. But that's what I try and have alongside the vision is to try and have a happy team.
I think also you need to be prepared to set the tone, be consistent. I mean, Dick always set the tone of how he wanted the clinic to run, and was prepared to, if he said everyone, we're going to do it this way, then he did do it that way himself. It's like parenting. You have to have consistent parenting. And I think, and that sounds incredibly patronizing about your team, but, one of the things I remember as a resident was we were standing in the ward, and a student was presenting the case, and the dog urinated all over the floor. And it was Dick who picked up the mop and cleaned the floor. And I always remembered that. And I made a point of, if I got my dog out of the kennel when I set up my own practice and there was diarrhea everywhere, I tied it up and I got the gloves on and I got on my knees and I cleaned that kennel. Somebody might come and stop you and say, for God's sake, you've got better things to do with your time, let me do that. But the point is, I demonstrated that I was prepared to do it, which meant that everyone else is prepared to do it.
I must say, you're spot on, Davina. I think if people have seen you cleaning the dog kennels at 4 o'clock in the morning, you can never be afraid to ask them to do the same.
These words are really gold, or I would say diamond dust, because nowadays, you don't see many people doing that. So, and because there is a misconception that this type of job belongs to someone else and not to us. So thank you for saying this. Thank you, Davina, because it's really, really important. It's a really important message for the young generations. And talking about the vision, obviously, when you did found your own referral hospital, so your vision was, we still know it, is excellence, trust, or care and trust. Can I ask you to give us your definition of these three important words?
Not easily on a Sunday night. It's interesting that we've been running the clinic for some years, and somebody had the bright idea that we needed to have a brand for the clinic, and so you get these branding guys in, and they go and ask questions, and they talk to people you work with. So those three words came out of what colleagues thought and about what clients thought about us. And it ain't rocket science. If you you know, if you care about the patients and the outcomes, then people will see that immediately. It doesn't, you know, it doesn't matter what profession you're in. If you're engaged and you care about the outcome, people will always see that. I think that's enough for a Sunday night. Come on.
Okay.
It's Chardonnay time.
Oh, Raffaella, the link for the donation, you will see now, if Paolo is so kind to put it again. Yes, it's this one, www.justgiving.com/vets4Ukraine. Come on, donate, because we are really nearly to the 5,000. So
yeah.
Thank you to everyone who has donated tonight, and please just keep doing it. I don't want to keep our guests longer because I know it's Sunday night, and
we just need to reiterate the quote from Bob Geldof years ago, which was, "Give us the bloody money."
Yeah, okay, maybe. Okay, give us the bloody money. What to say? So, Davina, Vicky, thank you so much. It was really kind for you to join us. I do really appreciate, and thank you. And Professor Dick White, thank you so much. It was a great talk.
Thank you for inviting me and for giving me the opportunity to participate, and thank you to all of the colleagues for the wonderful things they said about me, however untrue they were.
Yeah. Thank you to everyone, also Davina and Vicky, who have already done their talk. And reminder, all the talks are recorded and are on the YouTube channel, Veterinary. So you can find Davina, who spoke about the spay in dogs and cats, the pro and contras, and Vicky spoke about the wound management. So all very important and very good talks, high quality talks, and just spread the voice and obviously donate. Tetiana, thank you very much as well for being with us. It's been a pleasure to see you in person. I think to all of you, take care. Thank you so much, and bye-bye. Thank you. Thank you.